In this video, I'm going to walk you through some of the angiography associated with Hans's phenomenal ECG case. So on the first playthrough here of this LAO shot, using my standard annotation conventions, you've got left main coronary artery in black, LAD in red, diagonal in orange, circumflex in blue, and obtuse marginal in green. And on the first playthrough, you really don't see that much, or at least I didn't. You may notice there's a lesion here in the LAD, but nothing really jumps out as sufficient to satisfy the case as we understand it so far. But I'll let it play through again, and instead this time I'll freeze it on the most suggestive frame that I was really able to find. If you train your eyes on the circumflex, you see that sure, it goes along and it gives off an OM vessel and it gives off another OM vessel, but it does seem to terminate a little bit prematurely. I mean, you've got the whole inferolateral wall here that needs blood, and maybe that's coming from a big RCA. Maybe we haven't shot that yet, so we don't know if the RCA supplies blood here. But if not, you'd have to ask what's supplying blood here. And when you look extremely closely, you can actually see the beginning of a vessel there. Now, to be clear, even for an experienced angiographer, this would be really easy to overlook if you were not careful. I sent this to a couple friends that are better than I am at angiography and even told them there was an acute culprit, and they still had a lot of trouble finding this. Extremely easy to overlook. Even on the areocaudal view, which should be the most obvious view for spotting the circumflex and its branch vessels, it's still hard to see. Again, left main in black, LAD in red, diagonal in orange, circumflex in blue, and OM in green. And here the little dotted blue portion of the line represents the wispy ghost that's left of the circumflex as it continues past the occlusion. Fading my annotations away, you can see what I'm pointing to and saying this is just a little bit that's left of that vessel. And again, just for comparison, to show you one of the reasons you could suspect disease here is that on this shot of the RCA, you can see that it's a sizable vessel and it does give off a PDA system, but this posterolateral branch from the RCA is pretty unimpressive. It doesn't seem like it's enough to be perfusing that whole area that we saw on the inferolateral wall on the other views that didn't seem to be getting blood supply. So in the cath lab, if you're sitting there wondering what's causing this patient's symptoms, you have to use additional context, not just the angiography, which could be easy to overlook, but also asking yourself, are all the territories accounted for? And just to show you afterward, here is the size of the vessel that was completely occluded. You can see very convincingly it's a decent sized vessel, the distal circumflex, and this is actually what is supplying that territory that didn't seem to have any vessels running toward it.